Okay, welcome back to this final part where we have now run this 12 drug screen for 5 minutes as specified in the instructions, and we're just going to show you the results here now. If I bring this close up to the camera, we'll hopefully get a focus. And what we're looking for here is, if we just show you the demonstration results panels here, you need control lines, which is the upper line on all 11 of the drug screens, and we've got, if I rotate that round, nice clear control lines showing on all 11 of the drug screens. And then, interpreting your results, you're looking for the presence or absence of a test line. Now, you'll see three demonstration test lines being given here, from very dark to very faint. The very important thing in terms of your interpretation for the results is it does not matter how thin or faint the test line is. If it's clearly discernible in the presence of a control line at the read time, you must interpret that as a clear negative drug screen. Okay. Now, if we rotate these rounds, you will see a fair bit of variation. Just look at the difference in the colour density and saturation between that oxycodone result and the PCP next to it. That's because these are testing at very different sensitivities, and the membranes will give different results depending on how low particularly the sensitivity is for these drugs. But all those drug groups have a clear test line showing in the presence of the control line, so this is a completely negative result for all 11 drugs. And if I just compare on the colour chart the alcohol test pad, you'll see that that's remained the light beige colour. There's no green to indicate any presence of alcohol, so that is a negative alcohol blood screen or saliva test equivalent showing on this. So these tests actually all showed negative within about 2 minutes of adding the saliva. But at that stage there was still an element of the pink dye in the background, but those will still clearly be indicating negative results. And if you're happy and confident with that, you can move on to the next test at that stage. You must, however, in a presence of a control line but no test line, give it the full 10 minutes developing time before you interpret a positive indicator for this point of care test. So that is important. You can interpret your negative results very quickly with this technology, but you must give it the full 10-minute developing time before you interpret a positive indicator. Now, the vital thing to talk to you about is the need, if you're doing this in a workplace setting or healthcare setting, to confirm all positive indicators to identify the exact drug that is giving you that positive near patient screen. And that would need moving to a back to lab sample collection and test kit pack that would give you a GCMS result showing you the absolute level and drug that's giving you the positive point of care test. So there you have it. That's the new Nobex 12-in-1, 12 plus alcohol. It's a very comprehensive, easy to run, reliable saliva drug screening kit that really procedurally doesn't throw any problems. The key element we spoke to you earlier about is getting an adequate and good saliva sample and rubbing the swab around the mouth to collect any drug residue that you're going to pick up nicely with this. These are available now from the Drug Testing Kit website and UK Drug Testing.